Hello viewers, welcome to Disease Reversal and Mitigation Studio. We are again grateful to God for granting us another beautiful and wonderful day, and also a rare opportunity to continue with our series on immunodeficiency syndromes. Today we'll be looking at part 2, which is on test kits for immunodeficiency syndromes. And I consider this topic very important because many people in history and today have gone to treatment facilities and have undertaken antibody-based tests. And when a positive finding was given to them, they panicked, others were depressed, and still others committed suicide based on a diagnosis given by an antibody-based test. And this is where it gets serious because we are gambling with human life, and science has to be based on established evidence. Now, for that reason, traditionally, science has always been founded on the postulates of Robert Koch. Robert Koch was a German microbiologist who designed 4 postulates that need to be followed to establish whether an infectious agent is the real causative agent for any of the diseases that could be affecting individuals. And therefore, the 4 postulates are as follows. Remember, they are meant to determine whether that disease was caused by that specific infectious agent. And one of the founding doctrines of these 4 postulates is that a single microorganism should cause a single disease. And this is in line with the creation in the Bible, where God said that a single organism or microorganism should reproduce after its kind. So microorganisms should have specific diseases that bear characteristics that are specific to the infectious agent. And I need to emphasize this because in the 1990s, we were treated to a theory or supposition by science that an entity was causing more than 30 diseases. That was HIV. And we need to interrogate that claim to establish whether we have microorganisms that can cause so many diseases as far as genuine microorganisms are concerned. So the Koch postulates have been the standard of investigating infectious agents and their diseases. So the first postulate says that the microorganism must be found in abundance in a diseased organism, and the same microorganism should not be found in a healthy organism. So microorganisms should only be found in diseased organism. Then the microorganism must be isolated from the diseased organism and grown in pure culture. So it must be isolated and grown in pure culture. Then the cultured microorganism should be able to cause disease when introduced into a healthy, susceptible individual. And then lastly, which is postulate number 4, is that the microorganism should be re-isolated from the inoculated and diseased experimental host, and it should be found to be identical to the original microorganism which caused disease in the first host. So the 4 postulates are the basis of identifying whether an infectious agent actually caused the disease it is said to cause. Then after isolation and culturing, the microorganism should be observed under the transmission electron microscope, where pictures are taken and then published for peer review. And this is what should be done, and science knows that it is a standard of investigation of infectious agents. But you will be shocked. You'll be shocked. The science admits that certain microorganisms have never been cultured, have never been isolated, and have never been observed under the transmission electron microscope. Yet scientists have the confidence and the arrogance to boast and to associate certain diseases with those microorganisms. Yet they have never cultured or isolated or viewed them under the electron microscope. And these microorganisms include all viruses. That is the COVID virus, the HIV, the hepatitis B, the herpes, name all of them. They have never been cultured, they have never been isolated, and they've never been observed under the electron microscope. So the pictures you see of various viruses are designed by a computer program. It is not that they have ever been visualized. And you can follow up more details on viruses in a video I presented on the mystery of the origins of viruses. You can always find that video on my YouTube channel. Now, the other microorganisms that have never been isolated or viewed under the electron microscope are bacteria such as the one that causes syphilis, Treponema pallidum, Neisseria gonorrhoeae, Chlamydia trachomatis, Legionella, Mycoplasma, Bordetella pertussis. They have never been isolated or cultured or viewed under the electron microscope. Yet scientists will have the arrogance to say Bordetella pertussis causes whooping cough, or Chlamydia trachomatis causes a serious sexually transmitted disease, but they have no evidence in terms of isolation. Then they also claim that they have found notorious difficulties in capturing and isolation of parasites such as Toxoplasma gondii and Cryptosporidium, which are associated with gastric infections. They have also found difficulties in isolating fungus such as Pneumocystis jirovecii, and because of that, scientists have resorted to what we call serological tests. So these are antibody-based tests for those microorganisms. But antibody-based tests have significant challenges because these are indirect markers. They are not direct markers. They test for a response of the immune system to the presence of a microorganism that has never been isolated or cultured. So that is why we say they are not direct markers, they are indirect markers. And for that reason, they will never be able to detect the microorganism itself. Now, I want us to review some of the challenges any patient who has been given a diagnosis of being having an immunodeficiency syndrome based on an antibody-based test will face. So these are the challenges, and that is why these antibody-based tests are not consistent, and they should not be relied upon for giving a diagnosis. And unfortunately, most of these patients have been started on very toxic medications. And sorry to imagine, based on an antibody-based test. Now, I want you to reason out and listen carefully. If you think that antibody-based tests can be relied upon, proof number one, Did you know that the finding of the presence of antibodies of any microorganism should give you hope and joy? Because the presence of antibodies is a proof that your immune system is working and you've generated a good fight against the microorganism. And that is why the main principle of vaccination is based on antibody generation. So children will be vaccinated with the hope that the body will be stimulated to generate antibodies that will protect the child against a future infection. Therefore, the finding of positivity in an antibody-based test should give you joy and hope that the immune system is responding. Now, point number 2, antibody-based tests cannot distinguish between an active and a resolved infection because they do not determine the age of the antibodies being assessed. And because the body has the ability to keep memory cells, therefore, those tests can find antibodies of a disease that is fully resolved. So if you clear an infection, you retain antibodies for memory of that infection. So an antibody-based test will not discriminate between the antibodies because of an active infection and those that are generated or were generated because of a resolved infection. Now, point number 2 is there's a high probability of false negatives in an antibody-based test among the immunocompromised because immunocompromised people do not put up a fight against any microorganism, so they do not generate antibodies. So if somebody is in late stage cancer disease or they are using immunosuppressants or they have been radiated or have used chemotherapy, they will not be able to generate antibodies, and therefore the person may be infected with a microorganism, but the antibody-based test will return a false negative. That is why it should not be relied upon. So the same applies to those people who are in the window or incubation period. That is the time during which the body is in the process of making antibodies, and hence the antibody-based test will give you a false negative, yet you could be positive for the microorganism that is being assayed. So that is why they should not be relied upon. Then the other challenge with antibody-based test is there cannot be a standard or a generalized test for any individual, for all the individuals together. Why? Because viruses are said to be highly mutating, and therefore a virus in one individual will be different from the virus in another, because that is what the scientists claim, that they are highly mutating. And because they are rapid mutants, then we do not expect that we have a standardized test, antibody-based test, for all the people together. So those tests should be individualized. And because we do not have individualized tests, they are all general. That is why they cannot be relied upon. Now, the other challenge with the antibody-based test is on the fact that we are created differently, and our immune system, it's like a genetic code. It's like a fingerprint, which is different, which is diverse as the diversity we have in human beings. So no one immune system responds similar to another person's immune system. So for that reason, you cannot use a single test to test everybody. And for you to understand this fact, that is why patients who are looking for donor organs have found it difficult even to get donations from their own blood relatives. Why? Because immune systems are different. They are like a genetic code. It is different based on the individual. So why should we have a common antibody-based test for everybody? Yet we respond differently depending on the composition of our immune system. Now, the other challenge that antibody-based tests find themselves in is what we call cross-reactivity. And the reason for cross-reactivity simply means that somebody with malaria, when they take an HIV test, they can return a positive finding for HIV, which is a false positive. The same applies to tuberculosis, people with multiple pregnancies, people with high antibody titers. They can return a positive test for HIV, yet their condition is different. The microorganism they have is different from that one being targeted or assayed. So for that reason, microorganisms they share antigens, or what we call antibody binding sites. Because they are small, they are tiny, and hence they share these antigens. So there's a high likelihood of testing for a microorganism and returning a positive finding for another microorganism. For that reason, antibody tests are not reliable. Okay, the other reason why antibody tests should not be relied upon is because the body generates multiple antibodies for the same pathogen. Our body, our immune system is able to generate multiple antibodies for the different strains of the same pathogen. But when it comes to antibody-based tests, they are designed to pick only one component of that pathogen, because science is limited as to the technology in designing an antibody-based test that can capture all the components of a whole pathogen. And because they are limited in that ability, they design an antibody-based test for one component or a part of the microorganism. So the antibody-based tests cannot be relied upon because they do not reflect all the antibodies our natural body has generated against all the components of the pathogen that is suspected to cause disease. So that is how scientific knowledge, when compared to natural knowledge, is limited and found to be wanting. For that reason, to give you just an example, for instance with HIV, on the issue of cross-reactivity, more than 67 conditions have been found to cross-react with an HIV antibody-based test, such that a woman with multiple pregnancies, a multiparous woman, was testing positive for HIV, yet it is because of the high antibody titers resulting from the multiple pregnancies. Then you have people with a genetic condition we call hypergammaglobulinemia, who are born with ability to generate very many antibody titers, and they can also test positive for HIV, yet they are not HIV positive. Then you also have people who have been recently vaccinated, they test positive for HIV. People with autoimmune diseases, malaria, tuberculosis, people with fungal diseases, they have been tested positive for HIV, yet the reason for that positivity was because of the conditions that they have. For that reason, we are saying that antibody-based tests cannot be relied upon, and hence we need to look for other markers of immunodeficiency, such as the one we discussed in the previous video. So please search out on the video on immunodeficiencies and listen for yourself. What are the markers, the true markers from your own body of immunodeficiency or immunocompetence, so that you should never panic again or have depression or commit suicide when a diagnosis was given to you based on an antibody-based test. So believe in your body, believe in your nature, and believe on the markers of immunocompetence rather than believing in an antibody-based test, which is faulty. Thank you so much. Welcome. Continue to like, share, and subscribe to enhance visibility of these presentations. Until next time, bye-bye.